Welcome to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri, and today you're tuning into episode 5 when inflammation turns harmful, Anakinra and organ protection in COVID-19. So far, we have dug deep into cytokine storms and IL-1 signaling in COVID-19. But now we are zooming in on the real consequence organ damage. As the immune system mounts its defense against the virus, it can sometimes go too far, leaving the body vulnerable to its own response. And that's where Anakinra may come into play. To explore this in more detail, I'm thrilled to be joined once again by Aseema. Welcome back.
Thanks, Gaganasri. It's great to be back. This is such an important area to talk about, especially as we see COVID-19 impact multiple organ systems in patients.
Like always, let's start with the foundation. We know that COVID-19 doesn't just damage the lungs, it can affect multiple organs. But when we say inflammation causes organ damage, which organs are we exactly talking about, Aseema?
Well, the most commonly affected organs in case of severe COVID-19 are the lungs, kidneys, heart, and sometimes even the liver and the CNS, central nervous system as well. It's not just the virus itself that's causing the harm, it's the body's excessive inflammatory response where immune cells and cytokines start attacking its healthy tissues as well.
It's like the body's immune response has turned into a double-edged sword.
Yeah.
So it's like fighting the virus but also attacking its own organs. Now, when it comes to organ damage, how do cytokines like IL-1 come into play?
Cytokines like IL-1 beta along with IL-6 and TNF alpha are crucial in the inflammatory cascade. When they are elevated, they can disrupt blood vessel integrity, causing leaks and microthrombi as well. This damage impairs oxygen delivery to tissues and promotes widespread organ injury. So, IL-1 is very central to this damaging inflammatory cycle.
Let's hone in on the lungs first, since that's often where the battle begins. Asima, how does IL-1 specifically contribute to lung damage in COVID-19?
Well, in the lungs, IL-1 beta amplifies local inflammation. It recruits immune cells like neutrophils and increases the permeability of blood vessels. This leads to pulmonary edema, alveolar flooding, and ARDS, that is acute respiratory distress syndrome, as well. In some COVID-19 patients, IL-1 beta is elevated early, triggering the cascade that leads to severe lung complications.
So, in a way, IL-1 acts like an uninvited guest, right? Who
Yeah.
stirs up the chaos in the lungs and worsening the situation. Now, how does Anakinra step in to help to control this damage actually?
So, Anakinra works by blocking IL-1 signaling. It does not suppress the immune system completely, it just dampens the excess inflammation that causes tissue damage. And by blocking IL-1, Anakinra helps to reduce immune cell recruitment and cytokine amplification as well. And early administration, particularly in case of hyperinflammatory patients, can preserve lung function and even reduce the need for mechanical ventilation.
So, from my understanding, Anakinra is not exactly putting out the fire here, but it's stopping it from spreading uncontrollably. It seems like timing is critical, right? What about other organs like the kidneys or heart? Is IL-1 also contributing to the damage there?
Yeah, absolutely. In the kidneys, systemic inflammation and cytokines impair blood flow, leading to acute kidney injury, which is also referred to as AKI. And IL-1 plays a role in vascular inflammation as well, which worsens kidney perfusion and filtration. Similarly, in the heart, IL-1 beta can induce myocarditis and arrhythmias also and endothelial dysfunction. By targeting IL-1 early, Anakinra can help us mitigate this multi-organ stress.
It's almost like IL-1 is the root cause here, and by tackling it early on, we can prevent the body from spiraling into a widespread damage. Now, Asima, how do clinicians know when the inflammation is crossing a dangerous threshold?
Oh, great question. So, We look at biomarkers like C-reactive protein CRP, ferritin D dimer, and soluble urokinase plasminogen activator receptor, or like earlier we discussed suPAR. And elevated levels of these markers are associated with severe systemic inflammation and poor prognosis. And monitoring these biomarkers can help identify patients who may benefit from IL-1 blockade before irreversible organ damage occurs.
So I would consider they are just like a warning system. They alert us when things are about to go wrong. These biomarkers gives us a window of opportunity to intervene with Anakinra. But it seems the timing of administration is crucial here. Am I right?
Absolutely. There's a narrow therapeutic window where inflammation is escalating, but organ damage hasn't become irreversible yet. Anakinra's short half life makes it ideal for this intervention as it allows for flexibility in adjusting the dosage.
And have we seen that this window is where Anakinra can make a real difference in patient's outcome? Does the evidence suggest it's really helping preserve the organ function?
Yeah, so observational studies and clinical trials indicate that early use of anakinra, particularly in patients with rising inflammatory markers, but no respiratory failure yet, is linked to lower ICU admissions, reduced mechanical ventilation, and even improved survival. This rationale is quite simple. By limiting inflammation, we limit the collateral damage as well, and so patients recover better.
It's a really delicate balancing act.
Yeah.
Suppressing inflammation without compromising the immune system's ability to fight the virus. Aseema, this has been really insightful. It's clear that the inflammation isn't just a side effect, but a destructive force that we can target with precision.
It's always a pleasure, Gaganasri. The immune system is incredibly powerful, but like any powerful tool, it needs to be handled with care, especially in the context of a disease like COVID-19.
Thank you, Aseema. In our next episode, we'll take a deep dive into the data, how Anakinra has performed in clinical trials for acute COVID-19, what patient groups were studied, and what outcomes were observed. As always, this podcast is meant for educational purposes only and should not be considered medical advice. For health concerns, please speak with a licensed healthcare professional. Thanks for listening to Blocking the Flame, Anakinra, and COVID. We'll see you next time.